You've been on the forefront of menopause care since 2003. Way back then, before people were really talking about it, what was it that made you realize that this was an area that needed to be addressed?
So I'm an OBGYN by training, and I was about 41, and my patients who I've been taking care of for about 10 years were aging with me, and they were asking me questions I couldn't answer. So why am I gaining weight? Why am I having hot flashes? Why do I have vaginal dryness? Why don't I want to have sex? Why am I gaining weight? That was probably the biggest one. Or why do I just not feel like myself? And I'd be like, I don't know, I deliver babies, I do surgery, and I thought, you know what, if I'm not talking about menopause as a woman's health doctor, who's going to? I went to my first women's health meeting, I'll never forget, 2003 on Hilton Head at the Women's Journal of Women's Health meeting, and I was blown away about what actually is known about menopause, about how women age differently than men, a whole field we call gender-specific health, like why women develop heart disease different. So anyways, I learned a lot and I couldn't unsee it. So I came back and I started asking more people about menopause symptoms. I gave a couple talks and I was just blown away. It's like Pandora's box. Once you get a group of women talking about perimenopause or menopause, so much comes out. So I'm like, there is a lot going on here. So I'm like, I really need to know more so I can serve women.
Mm-hmm. And now it's being talked about. There's the Oprah special. You're being asked to be on the menopause panels by the governor.
Right.
And what do you think about that evolution of from not being addressed, kind of ignored, to now kind of being out in the open?
I think it's really exciting. I mean, first, just even for myself, giving talks, that was never the goal, right? But I love the line from the movie The American President. In the absence of truth, people listen to whoever's talking. And at the time, there was a lot of noise around hormones aren't safe. We now know they're way more safe than most people think. There was a lot of noise around you just got to deal with it or don't talk about it. And now the fact that people are talking about it, now it really gives a lot more power to, okay, every woman deserves to find her own solution. Every woman deserves a good menopause. So the more people talking about it doesn't mean that more people maybe have solutions, right? Or it's not their solution, or it's not about market share, selling products. It's about how can we just keep people talking about it so women are knowledgeable and empowered. So it's very exciting. It's a very exciting time.
When you say everybody deserves a good menopause, what do you mean by that?
So I mean that everyone experiences menopause differently. It might be because it's sudden menopause at 33 because of chemotherapy. It might be a sudden menopause because you had your ovaries removed because of endometriosis. It might be a natural menopause at 54. So number one, it's when it happens, how it happens, if it's gradual or sudden. Some women experience hot flashes. 80% of women experience hot flashes that affect the quality of their life. 20% don't. So those 20% of women, they might think, well, maybe I'm not in menopause, but they have weight gain, they have mood disturbance, they have sexual function issues or questions, they're not sleeping. A really thin woman might have cold flashes, right? So then she might not be aware. So bottom line, women have different experiences, different symptoms, so no matter what her symptom is, she deserves to know why it's happening and what she can do about it.
Quite simply, menopause, kind of the phase of a woman's life where the ovarian function is, I don't want to say ending, but how can we just quickly summarize what menopause is for people that might be watching?
Yeah. So menopause is when the ovaries run out of baby eggs. So the ovaries are not able anymore to make estrogen or progesterone. And over time after menopause, the ovaries can no longer make testosterone. And those are the hormones that generally help us feel normal. And it's not only the symptoms, but it's also the health consequences. So low estrogen causes an increase in obesity, diabetes, insulin resistance is a precursor of diabetes, increased risk for dementia, bone loss, mood disturbance, vaginal dryness, bladder infections, vaginal infections. So there are a lot of health consequences. So when people are in the first phase of ovarian function, reproductive phase, periods are regular. And as the periods start to change a little bit, sometimes women will get worse symptoms right before a period. So late reproductive is when you might get a menstrual migraine, more PMS, a night sweat 3 days before your period. Perimenopause is when things start to change more dramatically. Periods change by at least more than 7 days, and then they might be normal for a bit, and then they change again. And then late perimenopause is when a woman goes more than 60 days without a period, and the symptoms start to get worse. And then early menopause is that first 5 years of menopause where the symptoms are the worst, the changes are the quickest. And then late menopause is after that first 5 years of menopause. Now it's more about bone loss, vaginal dryness, bladder infections, all those things. So it's really important for women to know where they are in their phase of ovarian function and to know how can I get on top of this before I have those health consequences. We think about the current healthcare system. We spend 80% of healthcare dollars for chronic illness, for things that are preventable. And so if we can get on top of that before, knowing that at menopause, a woman's health is as good as it's going to get. So if we can really understand what are her risks as she goes into menopause, how can we mitigate those risks? I remember one time, another aha moment, I was on call at the hospital and for OB, I was delivering babies, and I got called up to the heart floor. It's not good when an OB gets called to the heart floor. So I was called to see a woman who was bleeding. She was 65. She had come into the hospital because she broke her hip. So she had osteoporosis. She broke a hip, didn't know she had osteoporosis. Then while she was having her surgery for her hip replacement to fix her hip that was broken, she had a heart attack. And then she had a stent placed. She was on blood thinners. She's up on the floor recovering, and now she has vaginal bleeding. So I walk in the room and she looks away and she's like, not another doctor. I've been healthy. I haven't been to the doctor in 10 years, which is partly why she had all this preventable illness, right? But I said, I'm here to see you for your bleeding. We did an ultrasound. I did a biopsy. She had uterine cancer. So this woman had silently developed 3 preventable illnesses, 3 preventable diseases. She had a hysterectomy. We treated her cancer. She did well. Her bones are now being treated, with, she can't take estrogen because she had stage 3 uterine cancer, but she's on medicines to help her bone health. She's on medicine to help her heart, but she wouldn't have needed any of that if I'd seen her when she was 45, with all the knowledge that I have now. So again, you ask, is it good that people are talking about it? 100% yes. So then women can take that information and then get help.
Yeah. Anything else that you want to add? Because as we were talking in the studio, menopause is the rest of your life. So this is a long chunk of your life to not have a good quality of life.
Yeah, that's a myth. A lot of women think menopause comes and it happens and it goes. And actually menopause is the new state of being. It's a lack of natural estrogen. So the next thing then is to think about what are options. So number one, menopause hormone therapy, MHT we now call it, is truly the gold standard. It is the most effective for hot flashes and night sweats for all the symptoms. And I would argue it's the most natural in the sense of you're taking bioidentical human estrogen that's FDA approved. Another myth is that insurance won't cover it or you have to get fancy creams through the mail. You don't. The hormones are paid for by most insurances and they are FDA approved and come at your regular pharmacy. Also, another myth is that you have to have your hormone levels checked. You really don't. We treat for symptoms. We're not treating a number, right? If hormones are not safe for you, maybe you've had a heart attack, or you have had breast cancer, or you've had over a stage 1 uterine cancer, then we now have other options. Or you just don't want to take hormones. You just can't do it from old fear. So there are a new class of drugs called the NKTs. And they have figured out how to treat the area in our brain that triggers a hot flash without having any of their effects of the estrogen. So the NKTs don't help with vaginal dryness, they don't help with bone health, but they treat the hot flashes and night sweats, and they also help women sleep. So the NKTs can help women sleep, so therefore they have energy, they don't have brain fog, they're not gaining weight as fast. Like, it really can make a difference in quality of life. For some women, it's really helpful to take a medicine even like what's called an SSRI. So they treat depression, anxiety, but they also work on the thermostat so they can treat hot flashes and night sweats. A healthy lifestyle is not treatment for menopause symptoms, but it's certainly an important foundation. So keeping your muscle mass going. We know from the study of women looking across the timeline, the SWAN study and other studies, we know that women who don't maintain their muscle mass gain weight. So if you're able to maintain your muscle mass, you'll protect your bones and you won't have that natural weight gain of menopause. So there's a lot of things you can do in terms of lifestyle, but again, next level is to actually seek treatment.
Okay. My challenge is boiling all this down to about 3 minutes now. Although I'd love to get your whole interview in this web story. I think you've got a lot of great information. Anything else that I'm missing that you want to add?
Yeah. So another thing to really consider is sexual health, and there are now 2 FDA-approved medications for low libido that can be helpful in the menopause, but it's also thinking about very practical things like vaginal dryness or bladder infections, and vaginal estrogen is very safe. Even for women who can't take systemic estrogen, like a patch or a pill, they can take vaginal estrogen. Vaginal estrogen in the right formulation does not go into the blood. It stays in the vagina. So it can help in terms of reducing pain with intercourse. It can treat bladder infection. It doesn't treat bladder infections, but it prevents bladder infections and prevents maybe even systemic infection like urosepsis, which can actually cause death in older women who get bad bladder infections. So anyways, vaginal estrogen is very safe and can be taken by anyone.